So good evening, everybody. Once again, my name is Manuel Castañeda, Director of Community Health at New Brunswick Tomorrow. And with me, as always, my partner in crime, Mary Merced, Director of Community Health at the Robert Wood Johnson University's Hospital Health Promotions Program. And I got it all right in one shot. So,
Yes, this is the third time, Manuel.
This is the third time. I'm probably going to mess up again, but, we celebrate the small wins, Mary. So definitely thank you for being here. And we have our special guest today, which is Mr. John Dowd, who is a health educator with the Middlesex County Office of Health Services. And we've asked John to join us on this particular day, day 3, because we're going to be talking about COVID-19 vaccine appointments, right? How to get an appointment, and just give you an update as to how that is going overall. And who better than to do that than a representative from the county, as the county is one of the lead organizations, right? Taking, kind of leading the efforts around vaccinating our community. And so, John, thank you so much for being here. Definitely appreciate everything that John does. John is, one of the many people in the county who does a lot of work in New Brunswick and for our community. He's, organized Walk with the Docs. So we've had walks at Bugalo Park and Joyce Kilmer Park, giving people the opportunity to get to know and ask physicians questions. He is an integral part of the New Brunswick Healthy Housing Collaborative and has done a great job with training our community health ambassadors on health issues and the community at large. And so he's a very busy guy, especially because I know he's doing a lot of work with the vaccine site. So we are very happy to have you here. Thank you, John, for joining us.
Thank you, John.
Thank you for having me. Hi, thank you, Miriam.
I think, John, that this is one of the most important topics that we are doing in Vaccine Week. We have done a lot of work in educating people about COVID, the importance of the vaccine. So here we are. We need to be able to have access to the vaccine. And like Manuel said, the county has been in the forefront of doing that kind of work. So we are all ears. We know we have some challenges, but you guys are putting together a plan to make sure that our most vulnerable communities have access to the vaccine, and we appreciate that.
Yeah, absolutely. So, John, if maybe what we can start with is, and we've gotten, questions from the community. So we're just going to field those questions to you. And I'm sure that will help at least guide the conversation moving forward. And one of the first things is about eligibility. I think people are still somewhat, they don't necessarily understand, who can sign up for the vaccine, or who's eligible right now. So can you walk us through that a bit right now in terms of who's eligible currently as of today?
Oh, sure. So currently vaccines are available to the following groups as per the state guidance. So individuals age 65 and older, individuals age 16 to 64 that have certain medical conditions, child care workers, educators and staff pre-K to grade 12, first responders, healthcare workers, high-risk individuals, long-term care, public safety workers, transportation workers, food production and food distributors, food distributor workers, elderly care and support personnel, warehousing and logistics staff, social services, election personnel, hospitality, medical supply chain employees, postal and shipping service workers, clergy, workers in the judicial system. And more recently coming up, beginning April 5th, individuals age 55 and over, there'll be additional expansion for those individuals with developmental disabilities and 16 and over.
Yeah, that's great. I want to bring us back to the previous slide because I definitely want to point this out. We know that our seniors are a vulnerable community here that are, some of them, we've actually heard from many seniors that are having difficulty in navigating the system and getting, the vaccine, even though technically, as you stated, they are eligible, right?
Yeah.
And so I'm happy to hear, and I'll let you kind of talk about it, but, I saw this, during the weekend and was so thrilled to see that that there's going to be a dedicated, effort to vaccinate our seniors. Can you talk about that a bit more?
Oh, sure. So seniors 65 and older, they can call 856-249-707, 7007. And then they can call the hotline at the state, and it's available from 8 a.m. to 8 p.m. To register, schedule, and reschedule appointments as needed for the vaccine.
Right.
That
And
is so important.
yeah, and as I shift this over, I just want to say that, this is continually changing, right? I know that the governor and the state health department are continually changing this, obviously with the guidance from the CDC. And so I just want to make sure that, that people are aware of that this is the list now, and what you just talked about are, so let me flip. It doesn't allow me to flip here. Hold on 1 second. Okay. This is the list as of April 5th. So next Monday, it'll be these people. But it's important that people know that if you look at the screen, there is the link. So you can copy that link to continue to get up to date list, right? Because they update that list continually as to who's eligible. But John, I've also heard, and correct me if I'm wrong, even if you're not eligible, you're able to pre-register. Is that correct?
Yeah, so basically you would just pre-register with the state. You enter your email and your other information, and then based upon that, you'll get what your phase or your eligibility is, and then you'll get that as an email. And then basically when it's your turn, you'll get a following email stating, hey, it's time to get your vaccine.
I just want to go back, Manuel, to that slide with the phone number for seniors to make an appointment. If many seniors, because they don't have computer access, they would not be able to see this. But if you know of a senior, please give them this phone number for them to make the appointment at their convenience.
Right.
Because most of them do have lines or have a little flip phone that they can make their own appointment. This will be great. Again, the number is 856, right?
Correct.
249-7007. I think that's great information.
Yeah, and they're open 8 to 8, so that's great. 8 in the morning to 8 at night. So that gives people enough time to really make that call. So definitely want to make sure that our seniors are getting the vaccine and that they're being protected. So for those of you, as Mariam said, that know of seniors that aren't able to view us or see us or didn't know about Vaccine Week, please let them know about this information.
And we assist individuals too here at our call center. So we provide information and kind of walk everyone through what we're going through right now. And we also take care of individuals to see, they can get a vaccine. If they don't have the internet or they don't have a computer access, they can always call our call center too here at the county at 732-745-3100 and press 1.
Great. Thank you, John. That's great information. And so can you talk to us a little bit about, how the county is operating their vaccine sites? Can you give us a bit more information on that?
So basically, we have 7 operating sites right now throughout the county. So basically, you would want to, your first step would be to pre-register with the state. And then step 2 would be to check your email to see if it's time for you to receive your vaccine. And then you could choose what location you want to go to. And then that would be kind of step 3, just monitor for future instructions or to kind of find the site that you want. So we have sites in New Brunswick, Perth Amboy, East Brunswick, Monroe, Sayreville, and Plainsboro.
That's
that
great.
We're currently utilizing.
Yeah, and I just popped up on the screen here, so as we look at just the local vaccine sites, to your point, right, it's important, and would you stress that it's important for people to register with the state first? It doesn't matter who they end up going with, they need to register with the state, is that correct?
Yeah, that's correct. So basically, you want to register with the state so you have an additional avenue of getting called for your turn to get the vaccine.
Great. And as you mentioned, you are here in New Brunswick. You guys are actually out of the Heldrick Hotel, right? That's by appointment only.
We're at the Heldrick Hotel and Conference Center.
Yep. And so for people that are interested in going through the county, you can go to the county website. The hyperlink is there, or you can call the call center and they'll help you. But you can then register for the vaccine, correct? But they're not the only providers. Although the main provider, and we appreciate them, we also have other providers here in the city that are vaccine sites as well. The first one is Robert Wood Johnson University Hospital. So Barry, let me not steal your thunder. This is your show. So can you speak a bit about what the hospital is doing in terms of providing vaccines?
So the hospital is also, it's a site for vaccine in New Brunswick and also at the mega site. If you see the link there in the slide. It's another alternative. It's very well organized, I must say. I volunteer at the clinic here at the hospital all the time, and it's very well organized.
Yeah, I can
There's
tell you,
also Chandler.
Yes. So with Chandler, right now it's their patients, but you can call them and you can pre-register with them. So the hyperlink is there, or you can call them and they can help you, and they will help you make the appointment. Right now, St. Peter's is also the hospital that's also now providing, vaccines. And again, you can call them or you can use the hyperlink here to sign up. But John, so it's good to see that, that there's different, entities or organizations providing the vaccine. But we have heard, a lot of people frustrated that they're saying, hey, I've tried to get an appointment and I can't get anywhere, or I've already pre-registered or registered, but I haven't heard anything. Is there a particular reason for that right now? That we should make the community aware of?
Well, initially, we were limited with supply with vaccine. And now vaccine is more into our different entities. So like now the pharmacies are starting to receive more additional vaccines. So people could also call out to CVS or Walmart's, and ShopRite have also part of the vaccine program as well.
Yeah, and I think it's important to note that the issue has been mostly, and correct me if I'm wrong, that we just had limited supply of vaccines, and so that obviously, if you have a limited supply, you can only provide vaccines with the number of vaccines you have. But is it correct to say that I've been hearing that has been starting to resolve itself, that we're getting more of a supply?
So it's actually, I think, more also providers as well too. There's more individuals that can now provide the vaccine, work, different sites that people could.
Would you say that a good piece of advice for people though is that we're trying to work these problems out and they just need to be a little patient, but we are trying to get people vaccinated, correct?
Yes, and that's what we do at the call center too. We advocate for individuals and we try and provide them different routes and different alternatives to get their vaccine.
I think that the other point that is important to talk about is that if you are offered a vaccine, the importance of taking whatever you've been offered, because if not, you're going to go back to the end of the list, right, John?
Well, it's good to have all your different options that you all the different ways here on this, on the slide that's being shown. You'd register with the state, you registered with Robert Wood Johnson. You called maybe a few pharmacies, and yes, if you get that email or you get, hey, sir, ma'am, I have an appointment for you. It'd be good to make that appointment.
And I know that the New Jersey site, so through the government, has a big list of all the vaccine sites. We've actually taken information from here. So as you see on your screen right now, and as John has mentioned, the pharmacies, certain pharmacies are now carrying it, like CVS and Rite Aid. We put a few that are in the area here for you to be able to try to get an appointment through. But there are more places, right? So that if you go to the hyperlink on the bottom, that'll give you not only the available sites in our county, but other counties. So you can look to see what other opportunities you may have in terms of getting the vaccine. And so, John, can you talk a bit about just COVID resources overall, because that's what we're talking about. And
yeah, so this is our county resource page. So basically, we have COVID-19 resources, assistance, and aid. So everyone, you could go to this website to learn more about COVID-19 and additional resources that you could utilize for support.
Great. And one of the things that we keep hearing, people are very anxious, right? Not just about getting an appointment, but just this has been a very difficult year. It's hard to believe that we're over a year now dealing with a pandemic. And we've heard from many community members that, it takes a toll on them and how they're feeling. Some are feeling anxious and depressed. And can you talk about the Warm Line and how that would help people in this situation?
Yeah, so basically the Warm Line was activated during events to help individuals that maybe need to discuss with somebody in regards to their current situation, and then get the support that they need to help them.
Great. And just for those who don't necessarily see the line, the Warm Line is 877-294-HELP. HELP actually being 4357. So 877-294-4357. And John, do you know, is that both? Is that in different languages? Is that just English, or is Spanish available as well?
There's other phone numbers too. I can probably maybe provide that to you at a different point, but yeah,
Okay.
there is other languages.
They're all, yeah, if you can get that to us, we'll definitely make sure that gets posted on Live Well as well as Su Salud New Brunswick, so that people are aware. They can call in the language they feel comfortable speaking to. So that's great to hear.
It's a great resource, John, because people lost loved ones, and this is a way to help them cope with what they're currently going through, and we appreciate that support.
And John, I guess for people who have a phone and they're technically savvy enough to get information, and they want to get updated information, there is an app too, right?
Yeah, so this is the state of New Jersey's COVID alert app. You could utilize it to get resources and information, and also if you set it up where you could get an email back if an individual or someone place that you visited, if there was an individual that had COVID, it would alert you.
How does it work at the sites of the county to get that second appointment while you're there? I know at the hospital they help you right there get that second appointment. Is that the same process at the county, like at the Heldridge?
What was the question in regards to the phone app, or just
No, the question was more in terms of how people how do they secure that second appointment? So for those people getting the Pfizer and Moderna, which we learned are 2 shots, right?
Yes.
If they come in for the first shot, how are they then scheduled for the second shot?
So they will get an email from the state in regards to making their appointment for their second dose. And again, we assist individuals here at the call center. If you didn't get that call, within 3-week time. So it was, the initial, so you had your initial vaccine, and then 3 weeks later, you still haven't gotten that email, or you might have missed it. You can always call our call center, and we could work to see if you can get your appointment for your vaccine.
Great.
Oh, and then this is just more information where people can kind of get that, right? So you talk about that, so Middlesex County, you guys have your website. I know I'm on it a lot, to make sure that I can get information. We put a lot of that information on Live Well BBB New Brunswick. So feel free to go on our website or our Facebook. I know Mariam does the same thing with Salud.
We share that all the time.
We're all sharing, so you can know that they are a trusted source and that we are utilizing them as a trusted source. So we're getting information from the county, and of course the county also has their social media. So please not only follow us, but follow them on their social media handles, and as well as the Department of Health, right? So it's not just the county, but right, John, there's the CDC and the Department of Health. These are the people that we should be relying on in terms of getting accurate information. Is that correct?
What was that question?
That our health department, that you at the county, the New Jersey Department of Health, and the CDC should be those people that we should really, or those organizations we should be seeking out to get accurate information on the vaccines. Is that correct?
Yeah, that is correct. So basically, you get your most up-to-date information by going on the state website and our county website for our local information, and for national information and overall information about COVID-19 would be the CDC.
Great. And what we want to kind of end on one thing. I know that Vaccine Week is about the vaccines, right? But there is, the importance still of COVID testing. John, can you speak to COVID testing and why it's still important, even though we're kind of, really concentrated on vaccines itself?
Yeah, so you still want to follow our protocols in regards to getting tested, because you want to try and prevent further spread of the disease within the community. So how do we know if we had the disease or not? We get tested. So we do have our testing site is still available in Piscataway, and you can go onto our website if you're looking for a test here from our office, and other offices and doctors also provide testing in the community.
Yes, and I also know that in New Brunswick, the city is also collaborating with the state and providing testing at 2 sites, Tuesdays at Unity Square, and there's also a site off of Van Dyke Ave. And so we will provide that information. We'll be providing that information on LiveWell as well. I'm sure Marion will provide that information as a list of places where people can get tested here, through Salud New Brunswick. So with that in mind.
Yeah, we also have one at Rutgers.
Right, Rutgers, that's right.
Have
Rutgers
something-
Institute for
one
Health.
at
That's right.
Rutgers,
Rutgers
at
Institute
the
for Health. So
Institute of Health. Yes.
So we promise to get that information out. We are creating just a quick one pager, just an information that we will be providing through social media so that you're aware of not only the county's testing sites, right, but also the other testing sites in the city that we've mentioned. Additionally, yes.
There was one more thing that I wanted to ask John.
Oh.
We want to ask about the cost of the vaccine. 'Cause that's a question that we get a lot.
Yeah, no cost for the vaccine.
So if somebody charges you, that's not right? That's
correct.
false. Yeah.
Yes,
Okay.
because we have gotten some complaints about residents that they've been trying to, somebody has told them that there's a cost. So we want to make sure that they know that the vaccine is free to everyone.
Okay. Yeah.
Well, John, thank you so much for all the information. I think, especially as Miriam stated, I think this is what we get the questions most about is how to get appointments, why it's taking so long. And I think at least we were able to hopefully clear up, some of that, and provide some information important about that. So thank you so much for your time. Miriam, we've gotten through day 3. So
Yes.
tomorrow,
Yeah.
will be interesting. We're going to be talking about, just certain concerns that certain marginalized communities, right? Communities that are Black and Brown have with respects to, vaccines and just, mistrust in the government. But we're also going to talk to some trusted leaders in the community, right? Including ourselves about why we decided to get vaccinated.
It's going to be very interesting. Very interesting.
Yep. So we'll see you tomorrow. John, thank you again.
Thank you so much, John.
Thanks, guys. Appreciate it. Thank you.
Bye.